Hey guys, Dr. Chris here with Drop Release, and we're today going to look at how we can apply the drop release protocol to a patient that we all see all the time, the desk worker with the upper cross syndrome, characteristic anterior head carriage, internal rotation of the shoulders, that sort of thing. So here we have Sydney, our lovely assistant today. So we're going to just look through here. She's got some really tight traps. You can see she's kind of forward in her head carriage. Shoulders are internally rotated. So I'm just going to go through and show a few of these things, like shoulder flexion restricted here unless I allow further movement of the thoracic spine or scapula. The left side is even more so. We'll bring this one up here. So she's pretty restricted over here, and this is not moving very well. Now, something else I've found with these patients is oftentimes they lack glenohumeral glide. And here, if we bring her into horizontal adduction, you can see that she's not gliding back and she's very restricted. So in order for her to reach in front of her or across her body, she's gonna have to recruit her pec minor and move that whole scapula, which is an issue because patients with anterior head carriage tend to have this really tight, she made the face, yeah, very tight pec minor. We're gonna look at this side as well. Very tight. Feel her suboccipitals are very tight, not as bad. And her first ribs are superior, very common. All right, I want you to put one hand on your chest, one on your stomach. Now take a deep breath for me. And she's all shoulders when she's breathing. Okay, very common also with our desk workers, so you can relax there. So, first thing I'm gonna do, and this is typically the way I approach all areas, working from the drop release protocols. I'm gonna go through, I'm gonna adjust the things that we've just found. Sydney's already been a patient, so we have her baseline neuro exam and everything like that has already been documented. So we're gonna go through here now and we're gonna just adjust the things that we just talked about. We'll recheck her and then we'll go ahead and apply the drop release and release what's left of the muscle problems, okay? So let's have you turn and sit toward the end there. Now I want you to put hands behind your head, elbows forward. We're gonna have you fall forward a little and oh yeah, her extension is really lacking. So let's cross your arms, this on that shoulder, zip under. Tuck your chin down and roll forward for me. Breath in and out. Here we go down. Nice and down. Good, you can stay there. So we got her thoracics moving now. I'm going to address this first rib issue. So we're gonna start over here. Let this just relax. Good. And we're gonna go to this side. Beautiful. First ribs are moving well. Now I'm gonna approach this glenohumeral joint glide dysfunction. I'm gonna use a drop piece to do this. There's a million different ways to do everything in chiropractic care, right? So use whatever you're comfortable with. This is the way I do it. It's gonna be a little loud with the drop piece here. All right, so I'm gonna bring this across, right about there. Table's gonna drop. Table didn't drop. Here we go. Good. There, that's better. Let this relax. Good, nice. So I'm just taking her to the limit of where she's at, and then I'm pushing straight back in the glenohumeral joint. There we go. And here. There, now we got good full accessory glide on in both directions. Let's face this side again. All right. So having just addressed those things with adjustments, let's see where we're at. All right, so that's already quite a lot better. And that moves very nicely. She's a little more upright. Side's still a little lacking. So here's where the drop release comes in. Drop release instrument. We're going to use this to trigger the stretch reflex that is mediated by the muscle spindle cells. And what that's going to do is it's going to cause relaxation of the muscle groups that we're targeting. That's going to help us get the rest of this range of motion back. So I'm going to put her into as much flexion as she'll go, and then I'm going to palpate the muscles that are opposing that movement. Okay, here we have nice tight lats. Subscapularis, we already know her pec minors are a mess. Very complimentary. All right. So let's have you hold that up like that. Now I'm going to target this lat, putting it on a stretch as far as it'll go. I have her activate, so we get the reciprocal inhibition side as well. I'm going to apply the tool here. We're going to put a little extra stress, and boom, drops just like the table. And we're already gaining range of motion. Here's another. Let's bend this arm, put your hand behind your head. Now I'm going to get it up into her pec minor, so I'm sliding my thumb in her armpit right along the front side of her rib cage until I find pec minor. And I'm going to come in there with a little ceiling. You Logan grads will get that. And I'm going to get into it and drop, and there we go. So we're getting better horizontal abduction. Flexion is really good now. Let's go rotate back. Okay, that's actually not too bad. Still going to work the internal rotators a little. There we go. Nice. And come this way. Nice. Okay, you can let that one down. Also going to check the upper trap here. What I'm going to do is I'm going to make a window with my fingers so I can increase the surface area that we're covering. And I'm going to shoot for right between them. There we go. And there. Nice. Now I'm going to whip through this side a little faster without all the explanation. Perfect, and bring it down this way a little further. All right, so there. Somebody's still restricting that movement, so go ahead and pull that down. All right, so that's how quick that can go on one side when you don't take the time to explain everything. So let's take another look. Let's bring this straight up. Okay, so that's all active right there. No excessive movement of thoracic spine. Let's go to the other side. There, nice and clear, nice and clean. Head carriage is already improved. Yeah, let's bring it back. Nice, and this side. Good, so. Definitely improved.
Yeah.
All right, so it can be as simple as that. Please stay tuned for more videos. If you have questions about specific conditions, feel free to email us, and please visit our website at droprelease.com. Find us and like us on Facebook.